Okay, let's talk about something that I know can be really tough for parents and caregivers to navigate, the Pediatric Genital Exam. It's one of those sensitive topics that can bring up a lot of questions and maybe even some anxiety. So our goal here is to just clear all that up. We're going to replace any uncertainty with clear, straightforward information so you feel empowered. All right, let's dive in. So here's how we're going to break this all down. We're going to tackle 4 big questions. First up, why is this exam even necessary in the first place? Then we'll get into how safety and trust are handled. After that, and this is a big one, we'll talk about when a doctor is actually required to make a report. And to finish things off, we'll give you some key takeaways you can use as a caregiver. All right, let's start with the question that probably brings a lot of you here. Picture this, your child has a problem that seems pretty simple, maybe some pain, but then the doctor suggests a really sensitive exam. I mean, that can be alarming, right? It's totally understandable. So it's absolutely crucial we understand the medical reasons behind that suggestion.
Yeah, this is the real question, isn't it? Your kid has pain when they pee, and the doctor wants to do a genital exam? It can feel like a huge leap, and it's easy to wonder why. So let's connect those dots.
Okay, this right here, this is probably the single most important thing to get from this first section. A genital exam is not an investigation. It's just standard, totally routine medical care when the symptoms are in that area. It's simply about a doctor trying to find the medical cause of a medical problem. That's it.
And what's pretty eye-opening is just how many different medical issues can actually cause these kinds of symptoms. I mean, you can see on the list, we're talking about a huge range of things, from a real medical emergency like testicular torsion in boys to really common stuff like labial adhesions in girls. And the key thing is, a lot of these can only be diagnosed with a quick visual check. It's often the fastest and sometimes the only way for a doctor to figure out what's really going on.
So this is a perfect example of how a doctor might explain it to you. It's simple, it's direct, and it's all about the medicine. See how it connects the symptom, the pain, directly to the action, the quick look. It brings it all back to finding a medical cause. It's about health, not suspicion.
Okay, so we've got the why covered. Now let's talk about the how. Because, understanding the strict professional standards that are always in place, well, that's what really helps build trust in this whole process.
Think of these 4 steps as the absolute bedrock of a professional, safe exam. This isn't just some informal, casual thing. Nope. Every single step is deliberate. You've got the clear explanation, your informed consent, a professional chaperone in the room, and then factual, neutral documentation. This whole structure is there to protect everyone involved, but most of all, the child.
So let's dig into that phrase, informed consent, for a second, because it's so much more than just you signing a form. Of course, it means you, the caregiver, totally get why the exam is needed. But, and this is so important, it also involves the child. There's a special term for this, assent. It's all about respecting the child's feelings, explaining things in a way they can understand, and giving them some control, like saying, hey, you can tell me to stop or take a break at any time.
And this brings us to another key part of the safety protocol, the chaperone. Now, this isn't just any other person in the room. They're a trained staff member, like a nurse or a medical assistant. Their whole job is to be an objective observer, just to make sure professional conduct is maintained from start to finish. And that's exactly why a family member, while you are absolutely welcome to be there, can't officially serve in that role.
Okay, this brings us to what is probably the most sensitive part of this whole conversation. Mandatory reporting. I know this can be a huge source of anxiety for caregivers, so our goal here is to just demystify it, to really understand the standard that doctors and nurses are legally and ethically required to follow.
So the key phrase that guides everything is reasonable suspicion. And this isn't about a gut feeling or a personal opinion. It's a specific legal and medical standard. The critical words here are that it's a concern based on facts about something that could be happening. And probably the most important thing for you to know is that it absolutely does not require proof or any kind of certainty.
Let's make this crystal clear. Reasonable suspicion is a concern based on facts that something is plausible. What it is not is a gut feeling or a guess. It's not proof. And this is a really critical distinction to make. The doctor's job is not to investigate. Their legal duty is simply to alert the experts, the folks at Child Protective Services, who are the ones trained to conduct a full investigation.
So how does a doctor actually apply this standard in a real exam room? Well, they look at the whole picture. They're trying to figure out if what they're seeing is likely accidental, a scrape from falling off a bike, or if it's medical, like dermatitis or a yeast infection. For something to become truly concerning, it usually has to be inconsistent with the story you're telling them. The question they're always asking is,
Does the story make sense with the injury and the child's age?
Let's use two really concrete examples to make this stick. Testicular torsion, that's a serious medical emergency, and it's something that would definitely require an exam, but it's not an abuse concern. On the flip side, what about a simple scrape? If there's a totally plausible story like she fell off the slide, that's not typically reportable either. See, context is absolutely everything.
All right, let's pull all of this together. In our final section, we're going to focus on some key principles, things you can actually use to feel more prepared and empowered, not just in this situation, but really in any medical setting with your child.
Okay, this is your key takeaway slide. If you remember nothing else, remember these 4 things. 1, these exams for urinary issues are routine medical tools. 2, there are strict safety protocols like consent and chaperones to protect your child. 3, reporting only happens when there's reasonable suspicion, which is based on facts, not just plausible accidents. And 4, and this is huge, clear communication with your doctor is everything. That's how you build trust.
And while we're on the topic of communication, this quote, it is such a powerful guide. If a child ever discloses something scary or harmful, the most important thing you can do is respond with empathy and belief. Just saying something simple like, "I'm so sorry that happened to you. Thank you for telling me." Wow, that validates their courage and instantly shows them you're a safe person.
And really, at the end of the day, that's what this is all about. We say knowledge is power, but it's also comfort. When you really understand the why and the how behind a medical procedure, it changes everything. You go from being a worried bystander to an informed, effective advocate for your child.
So I'll leave you with this one last thought to chew on. How can really understanding the why behind any medical procedure help you build a stronger partnership with your child's doctor? Because when we can move past that initial fear and get to a place of understanding, that's when we open the door to better conversations and ultimately better care for our kids. Thanks for listening.